Hello guys, Vanakkam and welcome to Meteor Academy, one of the leading academy in training nurses in their competitive exam as well as IELTS and OET training. And today the session is last minute test and revision for IGNOU Post Basic BSc Nursing Entrance upcoming exams. So all the questions are previously asked questions from IGNOU Post Basic BSc Nursing Entrance Exam. So just go through the video and get orient with all the questions. Let's begin the session. Guys, if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. And the disclaimer is, this video will be very useful for assessing your knowledge for upcoming IGNOU Post Basic BSc Nursing Entrance Exam. Here I have divided this video into two, that is part A and part B. Part A consists of test questions and part B consists of answers with rational. So take a paper and pencil and get ready for your test. Let's begin the part A. Judge the answer correctly and write it in a paper. At the last, evaluate yourself by checking the answer with rational from the part B. The first question is, International Council of Nurse was formed in the year. The options are 1899, 1898, 1897 and 1896. This question asked in IGNOU Post Basic BSc Nursing Entrance Exam 2014. The next question is, the primary purpose and criteria of nursing licensure is to. The options are limit practice, define the scope of practice, protect the public, outline legislative action. The next question is, the common preventable complication of abdominal surgery is. Options are urinary retention, atelectasis, electrolyte imbalance and fracture. This question asked in IGNOU 2013. The next question is, while nursing the patient with skeletal traction, all the following should be kept in mind except. Options are remove the weight while changing the position, maintain the accuracy of weight, ensure that weight does not touch the floor, remove the weight if required without causing jerk. This question asked in IGNOU 2011. The next question is, which is the most common feature of a child with hemophilia? Options are Petechiae, Hemarthosis, Bruising and clubbing. This question asked in IGNOU 2016. Next question is, patient is developing fat emboli. What will you observe first? Options are restlessness and agitation, increased BP and increased temperature, agitation and decreased urine output, decreased level of consciousness. This question asked in IGNOU Nursing Entrance Exam 2016. The next question is, knowing that toddler can be very negative and often use the word not, the nurse who is working with toddler should offer the toddler only acceptable choices, offer toddler no choice at all, involve the toddler in choices about his care, read the toddler a book about making choices. This question asked in IGNOU 2014. The next question is, a salty taste felt while kissing the child. Options are cystic fibrosis, celiac disease, hydronephrosis, Tay Sachs disease. This question asked in IGNOU Entrance Exam 2015. The next question is, patient with tibial fracture develop compartment syndrome due to the following condition. Options are internal pressure, internal and external pressure, internal BP. This question asked in 2021 IGNOU Entrance Exam. Next question is, a curdy white discharge during per speculum examination indicates. Options are trichomoniasis, candidiasis, bacterial vaginosis, cervicitis. This question asked in IGNOU Entrance Exam 2016. The next question is, the first step in the process of purification of water at large scale. Options are storage, filtration, disinfection and boiling. This question asked in 2012 IGNOU BSc Nursing Entrance Exam. The next question is, disease caused due to adulteration of mustard oil with arigmone oil is. The options are leprosy, dropsy, paralysis and plague. This question asked in 2014 IGNOU Post Basic BSc Nursing Entrance Exam. The next question is, type of defense mechanism interrupted by common quiet behavior of a client after any accident. Options are projection, rationalization, intellectual and denial. This question asked in 2012 IGNOU entrance exam. The next question is, when the thought are coming too quickly and the speech is increased, it is called as. Options are associative looseness, flight of ideas, Neologism, Dystonia. This question asked in IGNOU nursing entrance exam 2013. The next question is, when cold temperature prohibits the growth and reproduction of bacteria is known as. Options are bacteriostatic, bactericidal, aerobic and anaerobic. This question asked in IGNOU entrance exam 2011. Hope you have completed all the questions. Now it's the time for part B. Now compare the answer and learn the correct answer with rationals. Tell us how many of you got full marks. The first answer is, International Council of Nurses was formed in the year 1899, 1898, 1897 and 1896, and here the correct answer is option A. The ICN is the federation of more than 130 countries and the National Nurses Association formed in the year of 1899 with the headquarters in Geneva, Switzerland, and its main objective is to promote development of National Nurses Association. That's why we selected the answer option A, 1899. The next answer is, the primary purpose and criteria of nursing licensure is to. We have seen 4 options and here the correct answer is option C, protect the public. The rationale behind this is, the licensure is the granting of permission officially and legally or both to perform professional action. It is used to ensure minimum standard or competency to do the practice and to prevent the malpractice and to protect the health and well-being of the public. That's why we selected the option C, protect the public. The next answer is, the common preventable complication of abdominal surgery is urinary retention, atelectasis, electrolyte imbalance and fracture. So here the correct answer is option B, atelectasis. This question asked many times in the competitive exam. The rationale behind this is, atelectasis can be prevented by preoperative teaching of coughing and deep breathing exercise, and post-operatively frequent turning in the bed, early ambulation and use of incentive spirometer at least every 2 hours. The next answer is, while nursing the patient with skeletal traction, all the following should be kept in mind except, underline the word except. 4 options are given here. Already we saw all the options. Here the correct answer is option A, remove weight while changing the position. The reason is, the skeletal traction weight should not be removed during changing the position and transferring the patient from one department to another. It is because if weight is removed, the whole purpose of traction is failed and it may result in injury to the patient. That's why we selected the option A. Next answer is, which is the most common feature of a child with hemophilia? Options are Petechiae, Hemarthosis, Bruising, clubbing. And here the correct answer is option C, bruising. The rationale behind this is, the common clinical manifestation of hemophilia are abnormal bleeding after trauma like epistaxis, tendency to bruise easily. It is the most common one, tendency to bruise easily. Okay, and joint bleeding, hemarthosis. Petechiae are uncommon and are absent in hemophilia. The next answer is, patient is developing fat embolism. What will you observe first? 4 options are given here, restlessness and agitation, increased BP and temperature, agitation and decreased urinary output, decreased level of consciousness, and here the correct answer is option A. The rationale behind this is, finding the fat embolism include agitation, restlessness, headache, delirium, convulsion, coma, tachycardia, tachypnea, dyspnea, wheezing, blood thinning sputum, fever and petechiae. So these are all the manifestations. The next answer is, knowing that toddler can be very negative and often use the word not, the nurse who is working with toddler should. 4 options are given here. And here the correct answer is option C, involve the toddler in choices about his care. The rationale behind this is, the toddler often uses the word no even though they mean yes to ascertain their independence. So the nurse should involve the toddler in choices about his or her care to recognize their independence. That's why we selected the option C. Next answer is, a salty taste felt while kissing the child occurs in. So the options are cystic fibrosis, celiac disease, hydronephrosis and Tay Sachs disease. Here the correct answer is option A, cystic fibrosis. The rationale behind this is, infant tastes salty in cystic fibrosis when kissed due to high sodium and chloride in the sweat. Sweat chloride test is a gold standard test to identify this disease. Next answer is, patient with tibial fracture develop compartment syndrome due to the following condition. Many options are given here: internal pressure, internal and external pressure and internal BP. And here the correct answer is option B, internal as well as external pressure. The rationale behind this is, acute compartment syndrome can result from an external source like tight, bulky dressing and cast, or internal source, example blood or fluid accumulation. The next answer is, a curdy white discharge during per speculum examination indicates. Options are trichomoniasis, candidiasis, bacterial vaginosis, cervicitis. Here the correct answer is option B, that is candidiasis. Rationale is, candidiasis, otherwise called as moniliasis, is a fungal infection of the skin or mucous membrane with any species of candida, mainly because of Candida albicans. The next question is, the first step in the process of purification of water at large scale. The options are storage, filtration, disinfection and boiling. And here the correct answer is option A. There are 3 steps in purification of water on large scale. The first one is the storage of water, second filtration and third one is disinfection. The next answer is, disease caused due to adulteration of mustard oil with argemone oil is leprosy, dropsy, paralysis and plagues. These are all the options, and here the correct answer is option B, dropsy. The rationale behind this is, adulteration of mustard oil with argemone oil causes epidemic dropsy. It means sudden non-inflammatory edema in the legs. It is because of proteinuria, as well as diarrhea, dyspnea, cardiac failure and death may also occur. That's why we selected the option B. The next answer is, the type of defense mechanism interrupted by calm and quiet behavior of a client after any accident. The options are projection, rationalization, intellectual and denial. Here the correct answer is option C, intellectual. The rationale is, intellectual is a form of isolation in which the individual attempts to avoid the painful stimuli by using intellectual process by showing calm and quiet behavior after any accidents. The next answer is, when the thought is coming too quickly and the speech is increased is called as associative looseness, flight of ideas, neologism, dystonia. And here the correct answer is option A, associative looseness. The rationale is, the flight of ideas is a thought disorder characterized by too rapid flow of speech and thought in which the client jumps quickly from one topic to another, and it is most commonly seen in mania. The next answer is, when cold temperature prohibits the growth and reproduction of bacteria is called as. Options are bacteriostatic, bactericidal, aerobic and anaerobic. And here the correct answer is option A, bacteriostatic. Bacteriostatic means any agent, example chemical, cold, heat, etc., that inhibits the bacterial growth and reproduction and not destroying or killing them, whereas bactericidal means any chemical agent that kills the bacteria is called as bactericidal. Guys, thank you for watching this video. If this like this video, please again like it, subscribe it and don't forget to click on the bell icon. If you have any doubts anywhere, kindly drop your doubts in the chat box. We are always there to help you, and all the best for your IGNOU Post Basic BSc upcoming entrance exam.